My doctor has advised a glucose test during my pregnancy. So can I have breakfast before that? If no, can I have at least a glass of juice? How long do I need to fast? And what if I vomit after drinking that sugary solution? We will answer all your questions in this episode, so watch the video till the end. Hello and welcome to Trupt Wellness. This is Dr. Trupti and today we will talk about the screening and diagnostic test done for diabetes in pregnancy or gestational diabetes. There is a lot of confusion regarding the procedure of these tests at both patients and technicians' end. So let's clear it out. Before going to video, make a note that we are running a series on healthy weight loss on our Instagram handle. We are providing a lot of information daily on the basis of Ayurvedic and modern nutrition. So check it out. Now, why these tests are advised during pregnancy? So these tests will help to understand that whether your body is capable to handle the particular amount of glucose load or not. These are also of two types, screening and diagnostic. Screening tests are glucose sensitivity test or glucose challenge test, which is also called as GCT, and the diagnostic tests are GTT, that is glucose tolerance test, or it is also called as OGTT, which is oral glucose tolerance test. Now, whenever you go to your doctor's office for the very first time after getting your urine pregnancy test positive, your doctor will advise some routine tests. If all those routine tests are normal, then you will be directly screened for diabetes in 6 months, that is between 24 to 28 weeks of pregnancy. Why this screening test is necessary if my routine tests are normal? So there are always 25% chances for a normal woman as well to get diabetes. Means though you were not diabetic in your previous pregnancy, though you don't have any history of diabetes, or you do not fall in the category of overweight or obese, still you have 25% chances to get gestational diabetes. And if you have high glucose levels in your urine during your prenatal visit, then your doctor will advise the GTT or a glucose tolerance test, which is a diagnostic test. Now let's move to the procedures of these tests. First, let's talk about GCT, that is glucose challenge test, or which is also called as glucose sensitivity test. This is recommended by ADA, American Diabetes Association, and this is followed outside India in rest of the world. Here, patients are given 50 grams of glucose mixed in a glass full of water in a non-fasting state, means at any time during their prenatal visits. The water should be around 200 to 300 ml and the patient has to drink that solution within 5 minutes. The blood sample is taken after 1 hour. If the values are below or equal to 140, then the test is normal, and if the values are above 140, then you are screened positive for gestational diabetes and you will be advised a diagnostic test on the next day, that is GTT. Now on the next day, GTT or OGTT, that is oral glucose tolerance test, is performed. Remember, these are the tests which are performed or followed outside India in rest of the world. Here the patient is called in a fasting state. She has to fast for 8 to 10 hours or overnight. She can take plain water but no juices or any snacks are allowed. The first sample is taken in the fasting state whenever the patient arrives in the lab, and then patient is given 100 grams of glucose mixed in a glass of water, that is around 200 to 300 ml of water. Now the patient has to drink this sugary solution within 5 minutes of time. And then the blood samples are taken after 1 hour, after 2 hours and after 3 hours. If the patient vomits after drinking that sugary solution within 30 minutes of time, then the test should be cancelled on that day and postponed on some other day. The results of this test are interpreted as follows. The cutoff value for fasting level is 95 mg per deciliter or 5.3 millimoles per liter. For 1 hour is 180 mg per deciliter or 10 millimoles per liter. For 2 hours is 155 mg per deciliter or 8.6 millimoles per liter, and for 3 hours is 140 mg per deciliter or 7.8 millimoles per liter. Now, out of these 4 values, if 2 or more values are higher, then you are diagnosed as gestational diabetes mellitus. And if only 1 value is high, then your doctor will advise some dietary changes and lifestyle changes, and they will ask you to check again. Now, in India, one-step screening or diagnostic test criteria is applied, which was recommended by WHO after 1999. Here, patients are given 75 grams of glucose solution mixed in a glass of water, that is around 200 to 300 ml of water, in non-fasting state. Means patient has to drink this solution at any time of the day whenever they visit their OPDs. The blood sample is taken after 2 hours, and if the values are above 140 mg per deciliter, then the patient is positive for gestational diabetes. And further, fasting and postprandial blood tests are done to decide the line of treatment. Now, this is the glucose sensitivity test or glucose challenge test done in India, which is followed till date. But the sensitivity and specificity of this test was low, so WHO and IADPSG has recommended some new criteria, which is 75 gram glucose test in fasting state. So this is called as GTT or OGTT, which is followed in India. Now here patients are called in fasting state. The fasting should be overnight or minimum 8 to 10 hours. You can take only plain water, no juices, no snacks are allowed. The first sample is taken in fasting state, and then the patient is given 75 grams of glucose load in 1 glass of water. Water should be around 200 to 300 ml. Now the blood sample is taken after 1 hour and after 2 hours. And the results are interpreted as follows. The cutoff for fasting values is 92 mg per deciliter or 5.1 millimole per liter. After 1 hour is 180 mg per deciliter or 10 millimoles per liter, and after 2 hours is 153 mg per deciliter or 8.5 millimole per liter. Now again in this, 2 categories are made, A1 and A2. So if the fasting is less than 95, after 1 hour values are less than 140, and after 2 hours if the values are less than 120, then the patient is managed on the diet, exercise and lifestyle modifications itself. And if the patient falls in A2 category, then medicines and insulin is recommended as per the need of the patient. Now lastly, what are the precautions you need to take before going to these tests? So the first one is, if you are taking medicines like beta blockers which are given for high blood pressure, other one is antidepressant or steroids, then you have to stop the medication 2 days before going to the test, obviously with advice of your doctor. The second one is, if you vomit after drinking the sugary solution within 30 minutes of time, then discontinue the test on that same day. And the third point is, during the fasting hours, you can take only plain water if you feel hungry. No milk, no juices, no snacks are allowed. I hope that you have understood the difference between glucose challenge test and glucose tolerance test now. So this was all about that. Let's meet in next episode. Till then, stay happy, stay blessed. Thank you.